The answer to the question, why is it difficult to believe in the advertised higher cost effectiveness of new drugs, is on the surface. Much of the research here is industry-sponsored and tends to more often conclude that the new investigational drug is more effective than the comparator drug. The authors of these studies very often speak at various scientific events in support of the clinical introduction of new drugs. Moreover, they are often the authors of updated clinical guidelines that include recommendations for the use of these new drugs in medical practice. You may be interested to know that studies sponsored in this way are twice as likely to reach these conclusions at $50,000, nearly 3 times as likely at $100,000, and 3.3 times as likely at $150,000. The consequence of this is that we all end up paying a higher price for medicines as users of health systems. Cost-effectiveness analysis of new medicines can only be very useful for clinical practice when decision-makers are impartial about research results. Biased results can lead to the adoption of treatments that will not benefit patients or health systems. Until these issues are fully resolved, I will continue to be cautious about advertising new drugs, and I advise you to do the same. Who is armed is protected. Take care of yourself and be healthy.